In this case, you're going to see a patient who did not like her nose. She wasn't even clear on all the reasons why. She has a dorsal bump, and you can see by the shape of it that is more dominant on her left side. This means what she sees in certain lights is a different shaped nose. It also goes alongside a flattening of the tip of her nose, which meant she had a very slight curvature alongside the complexity. So in this case, you will see me treat the nose in order to simplify, straighten up the lines of the nose. Unfortunately, there was an artery exactly where I wouldn't want it, so I switched techniques. So you'll see me deal with how to inject when you know there's a blood vessel in the way and still get a great result. It's particularly interesting to see the tip of her nose treated and the safety steps that I took in order to validate that there was room to do this procedure. I hope you learn a lot from it. So I'm scanning again because unlike little Bella, there actually there were quite a few little vessels here. So I'm just going to refresh myself to the depth of those vessels. I actually don't see any in the area I'm most interested in. There's a slight inward curve here, which is part of this, and why from certain angles it will look less straight than from others. Very subtle, but that's what I'm trying to see now as I inject. To choose the most efficient place to hide this little bump here. So I'm in position, I've aspirated negative, I've compressed the arteries that I'd worry about with the eyes. And then we do less than what it would take to block a vessel anyway. 0.05, I'm going to move it slightly. Repeat the same process. Aspirate. On periosteum, give it time, compress the vessels. Little injection, seeing the tissue rise, which is all reassuring. Repeat again. Small volumes each time. See this curvature, this bump here, that's what we're trying to hide. Done a good job, but there's a little gap here. Go with bevel down. So that now looks from this aspect to be straight. It's just whether we can now blend in the lower tip using some of the same ideas really. So I can see a dorsal nasal artery running here. It is running right where I might inject, so it makes me want to maybe use a cannula and go off the midline. I don't like using cannulas along the dorsum for exactly the reason, but if I'm going at 90 degrees to the artery, then I feel much safer. So because this vessel is running like that, it's right where I might place a needle, but if I go midline and go with the cannula, then I'm at 90 degrees to that vessel. The chances of injecting significant filler is low. No bleeding's good. Same principles as we always have with using cannula, which is it nice and mobile. Nothing wrong with aspirating. Gently add a small amount of product. Check no blanching. There's one downside with an entry point here is if you get swelling, it's going to look like the nose is more curved than it really is. So aspirating, small injection. So if it pops through or there's a lot of resistance, I'll stop and aspirate again. And then small volumes each time. The straightness of the nose is interrupted by a very slight flat point here, which I noticed when you were talking. As you pulled up, it kind of straightened it. So we could put a tiny bit here just to make that straighter.
Yeah.
Now, before I do this, I'm always checking how much room is there. Does this tissue move easily? So the tip is a little bit firm. I wouldn't feel confident adding much here, but just above it, the tissue raises quite easily. So I'll probably put my needle down to about that level and just try and get a little gentle curve here, and it'll be a very small amount of product. Go through the same hole. Now the tip is lower risk for blocking a vessel because there are mainly just capillaries there, but it's higher risk for blocking capillaries, so compressing capillaries, which is slightly different. Compression causes redness that persists, whereas if you block an artery, then obviously you're not getting any blood at all, and that's different, much higher risk. So I'm going to put a little gentle curve on my cannula. And when I tilt the cannula, I should see the effect that I want. I don't want any filler around where I'm injecting. I'm going to aspirate. See the tip of the cannula here. And then gently inject. It's 0.5. Well worth it. That made a really nice difference. Hopefully I can catch it on the side of the camera. If you turn your head away from me. I hope you can see her nose is now completely straight. We had before then a flat point just here. So very subtle. Yeah.
It's like precision sculpting, isn't it? It's like a real precision. I can't wait to see it. Oh wow. Oh, that's made. Oh my God, look at my nose. Oh my God, I love it. Oh wow, that's made a massive difference. That's made a huge difference, but really subtle, but I can see a massive difference. Oh my God, I love my nose. I can't believe I'm looking at my nose and I actually love my nose. Oh my God, look at my nose. I can't believe my nose. I can't believe the difference that's made to my nose.
So good, isn't it?
Wow. I've hated my nose for so many years. Look at my nose. Oh my God. I can't believe, oh yeah, it's made a massive difference, but really subtle. But look at my nose. Oh my God, I can't.
Oh, I'm so happy for you.
It's my nose that really, because I've looked at my nose for so long, you know how many times you look in the mirror and I hate it. And how many times I've got it and gone, you know, just try to, and if I just do that a little bit, I'm sure that will look better. I can't believe that. I actually can't believe that has been done. Wow.